Well, thank you for joining us today. My name is Josie McSpadden, and I'm a Senior Communications Officer here at the Foundation. We are here to take your questions about our investments to several historically Black colleges and universities participating in the JUST project as part of the Foundation's overall COVID-19 response. Each of our guests will give brief opening remarks, and then we're going to open it up to questions. Today we have with us Alan Goldston, the president of our U.S. program here at the Bill and Melinda Gates Foundation, Dr. Tony Hoover, our Director for Strategy, Planning, and Management for Global Health, also at the Foundation, Dr. Wayne Frederick, the President of Howard University, Dr. Larry Robinson, the President of Florida A&M University, Dr. Reynold Verrett, the President of Xavier University of Louisiana, Patrick Johnson, the Senior Vice President for Institutional Advancement at Meharry Medical College, Dr. William Harvey, the President of Hampton University, and Dr. Sandra Harris Hooker, the Vice President and Executive Vice Dean for Research and Academic Affairs at Morehouse School of Medicine. For journalists today, in order to ask a question, you'll go to the Q&A portion of WebEx and type in your question. I'll call on you, you'll be unmuted and able to ask your own question. Just a reminder that I ask you to tell us what organization that you're with and exactly who your question is directed to. If we don't get your question in today because of time constraints, we'll do our very best to follow up. And just a note that in terms of view today, there's a small icon you'll notice on the top right of your screen right now, and that will toggle you between 3 different views. It's up to you, obviously, which one works best for you, but I know there's some local television joining us today, and you may want to go ahead and look at what's called the active speaker view. A few last reminders for today. The news is embargoed until 12 p.m. Eastern today, and this call here is both recorded and on the record. So thank you so much for taking the time to join us, and now to Alan Goldston.
Thank you, Josie, and good morning to everyone, and happy Tuesday. And thank you so much for taking the time to join us. So COVID-19 is exposing some hard truths about inequity in the United States, and particularly its impact on the Black community. The CDC is reporting that Black Americans are twice as likely as whites to be infected with the virus and to die from it. And the Sergo Foundation recently estimated that Blacks are nearly 3 times more likely than whites to live in an area with insufficient diagnostic testing. And at the same time, we're also seeing a disturbing trend in the rise of COVID-19 among young adults. The CDC has recently reported that COVID-19 infections among young adults aged 18 to 22 increased 55% between August and September of this year. So these data suggest that our nation's historically Black colleges and universities, who are more than 100 strong, who serve more than 250,000 students across this country, and a critical resource of educational opportunity, face real challenges and opportunities in this pandemic. Safely reopening campuses and keeping them open requires a number of things, but it absolutely requires access to rapid, effective COVID-19 diagnostic testing. And a number of HBCUs have already begun to partner and lead on this issue, because they understand better than anyone how critical rapid, effective diagnostic testing is for the safety of their students, their faculty, administration, and surrounding communities. So today, we are proud to announce a $15 million investment to support those efforts as part of the Foundation's overall COVID-19 response. For context, to date, the Foundation has invested more than $350 million to support the global health response to COVID-19. And in our US program, we have deployed funds across strategies to support schools and districts and states to navigate this pandemic and to invest in the research and the interventions that will help strengthen our education systems and communities now and through the recovery from this pandemic. There is no question that there is a tremendous overall need related to COVID-19 in education. And this represents a unique opportunity to support those efforts that are already underway, one that sits at the intersection of our health and our education priorities. and to keep students on track to achieve their educational goals and to stay safe from the coronavirus, we absolutely have to reduce the disparities in access to testing, period. These HBCUs have emerged as leaders on this issue, and we're proud to be supporting them as they work to ensure that this public health crisis does not become an opportunity crisis for their students and communities. And there is hope that this hub and spoke model to testing could be applied to other colleges and universities grappling with similar challenges. And now I'd like to turn the program over to my colleague, Dr. Tony Hoover, who's the Foundation's Director of Strategy, Planning, and Management for Global Health. And Tony will provide more information about our investment. Thank you. And Tony, I'll turn it over to you.
Thank you, Alan, and good morning, everyone. As Alan has said, we are so pleased to commit $15 million over the next 3 years to this effort. Our funding to these institutions will provide test processing equipment, supplies, personnel, training capabilities at up to 10 historically Black colleges and universities that will serve as testing hubs in a hub and spoke network. The hubs, which are institutions with medical, veterinary, pharmacy, public health, or agricultural schools with lab infrastructure, will partner with the HBCUs, processing the diagnostic tests administered on those campuses and providing rapid results. Target turnaround times are within 24 to 48 hours. For testing to be effective, we know that it has to be accurate and timely. We have identified 6 institutions that will function as these testing hubs. Florida A&M University in Tallahassee, Florida, Hampton University in Hampton, Virginia, Howard University in Washington, D.C., Meharry University in Nashville, Tennessee, Morehouse School of Medicine in Atlanta, Georgia, and Xavier University of Louisiana in New Orleans. We'll be hearing from some of these leaders shortly, and we are going to be working to find additional hubs, up to an additional 4 hubs, which we will be announcing at a later point in time. We're making this 3-year commitment to this work for 2 reasons. First, the colleges and universities will continue to need access to diagnostic testing and test processing until vaccines and therapeutics are universally available and accessible. And we know that those estimates of when these will become available vary widely. The second reason we're making the 3-year commitment to these institutions is even more important. It will enable them to strengthen their lab capabilities and research capacities. And these benefits will extend way beyond the COVID-19 pandemic. So in closing, I'd like to underscore how excited we are to support the collaboration that is already underway with these universities. No single grant or set of grants can address all the need created by this pandemic, but it's our hope that we can help extend the reach of rapid, effective diagnostic testing and perhaps catalyze similar partnerships in other communities. So we look forward to your questions.
Thank you. Thank you so much, Tony. Let's go ahead and go to Dr. Frederick for a few remarks.
Yeah, sure. Thanks, and good morning to everyone. First, let me start by thanking Mr. Goldston and Ms. Hoover for their vision and insight. Obviously, the Gates Foundation is the major engine behind this, but without people who have the vision to execute on the foundations overall, we won't be here. So I certainly want to thank both of them for their vision around this. Howard University is the only federally chartered HBCU and the only one that owns its own hospital at this present time. And that puts us in a unique role. We send more African Americans to medical school than anyone else in the country presently. And as a result, we have a very important role to play in terms of supplying diversity to that workforce. We also employ more African American faculty than any other higher ed institution in the country. So protecting our community from this pandemic is critical. And a critical aspect of that, as you can imagine, is testing. The diagnostic aspect of what must be done around controlling this pandemic and its spread is absolutely critical. We've had our lab up now and running for the past 4 weeks as one of the hubs, and we also have been extending out to a couple of spokes, as was described, in some doing testing for a couple of HBCUs already, and it has proven to be an absolutely great addition to our campus, having a clear certified lab and having the gift from the Gates Foundation to ensure that we can do that testing at a high quality and that we can hire the appropriate personnel has been an invaluable resource. And as I close, the other thing that's important is we do a lot of interprofessional education. We have a dental school, medical school, pharmacy school, the only pharmacy school and dental school in the district. And we have a nursing and allied health school as well. So the other opportunity that this lab has provided is that our students, for instance, in our clinical laboratory studies department have had an opportunity to participate in seeing this lab stood up and seeing its operations, et cetera. And there's nothing like that practical participation in the work that must be done to keep everyone protected and in the community as well. As Mr. Goldston and Ms. Hoover pointed out, the risk to African Americans has been well documented throughout this pandemic. And long after a vaccine is available, we will still have risk related to underlying health conditions. And this lab will continue to be useful as we manage our population. So once again, my heartfelt thanks to the Gates Foundation for their vision. And while no one grant, as Ms. Hoover said, will undo the inequities, this certainly is a giant step on the journey to social justice. And so we appreciate the foresight and the vision and certainly the generosity.
Thank you. Okay, let's go ahead and go to Dr. Larry Robinson with Florida A&M.
Well, thank you, Josie. And I also want to give a great, deal of thanks and appreciation to the Bill and Melinda Gates Foundation for having the vision to see how this investment could make tremendous impacts or generate tremendous yields on return with regards to what it's going to do within the HBCU community, but even broader within the African American communities around this nation. And so I too want to thank Tony and Alan for working to make this happen and doing it in such a relatively short fashion, but not too soon and certainly not too late. We have had on our campus since April the 25th a community-based state-operated COVID-19 testing site where, as of today, we've tested, over 56,000 tests at the center. It's been tremendously valuable because it's right here on the side of town where the need, in my opinion, is greatest in terms of socioeconomic issues, race, and so forth, where those disparities are occurring in the state of Florida. And so to have this opportunity to go beyond that and drill down into our faculty, our staff, and our students more is going to be extremely helpful. And beyond that, the vision of saying, okay, let's try not to leave anyone out. We'll also be able to provide testing services for our fellow 3 other HBCUs in the state of Florida. Will have a tremendous impact because all of us are located in these very special communities where these disparities are occurring and where the impact, I believe, will be tremendously great. It's going to take a while for us to get beyond this pandemic, but we know the critical role of testing in order for that to occur. At our institution, we've had to develop a reopening plan to just start back from the spring, the summer, and the fall. And as things have progressed, we're moving into a mode where we'll likely have a greater presence of students, faculty, and staff on campus being able to test them is critical to help to ensure their safety as we move into sort of a new normal in terms of our operations. So I want to thank you for giving us this opportunity to do so. We've been working with our College of Pharmacy, our Institute of Public Health, our College of Agriculture, College of Arts and Sciences, all part of this initiative. Your donation to Florida A&M University specifically will allow us to hire people that are necessary to maintain a CLIA certified laboratory, and as an educational institution, allow us to support, training and educating that next generation of scientists and problem solvers, which we've done throughout our 133-year history. And I'll end on that point. 10 days ago, we celebrated our Founders Day, 133 years ago, where 2 faculty and 15 students converged in this special place we call Florida A&M University. Little did they know the challenges that we would face, but little did they also know the tremendous impact this institution was going to have. I think that this investment will help us ensure another 133 years of Florida A&M University, because beyond the disparity in health and so forth that our students and their families face, there's also an economic disparity that they're challenged with as well. Our ability to keep them healthy and sound as we get through this pandemic is critical to minimizing, the impacts of both of those on their lives and their families. So I really just want to thank the Gates Foundation for having a vision to see how such an investment like this would yield such a tremendous set of impacts across African-American communities in this nation. So thank you very much.
Thank you, Dr. Robinson. Let's move over to Dr. Verrett with Xavier University of Louisiana.
Good morning, and thank you very much for having us. Deep appreciation to the Gates Foundation for the vision to actually support this effort at our institutions, because the effort is not only for our institutions, but also for the larger communities of HBCUs in our regions, but also for our community as well. When Xavier itself, not only, I think, was chosen not only because of its pharmacy program, which is the longest standing pharmacy program in Louisiana, one of 2, but also that it's the depth of STEM effort at education at Xavier, and also its other allied health programs, such as physician assistance program. But also that Xavier has a long-standing commitment, both internally and externally, to service. When Xavier returned, when we made the decision to return in person, that decision had depended upon only if we could provide safety, not only to our students, but a measure of safety to our faculty and staff and to the larger community. We also were concerned also that the students who were coming back to Xavier were coming from the 39 to 40 states in the country, and that they were coming back and not being a threat to the community that they were re-entering. So the testing program that you have facilitated with us is key to making sure that we keep safety on our campus, but also that we serve our larger community by making sure that the community, that we are able to re-enter safely. The facility that you gave us also allows us to do in-person education and to do it well in safety. It was known to us that in-person education is valuable to our students, especially our students, not only for their success academically at Xavier, but for the postgraduate programs that they enter in. Xavier has educated more physicians who go on, more African Americans who go on to become physicians than any other institution in the country for many years, and we continue to do so. And part of that education is in-person education that we receive at Xavier, and they are doing it safely here. But not only that, the service you provide is allowing the other HBCUs in our region as well, who need this facility to be able to engage in education safely as well. So I want to thank you. I want to thank you not only for Xavier University, for our sister HBCUs, but also for the city of New Orleans, because you are providing a measure of safety to the community as well. Thank you.
Thank you, Dr. Verrett. Let's go ahead to Patrick Johnson. Patrick, you're muted. And I should have added, you're with Meharry Medical College again. Thank you.
Thank you, Josie. I just want to echo what the previous president said about the impact of this gift and what it means to the greater community that we all serve. For those of you who don't know, here at Meharry Medical College, we have been involved in running 3 very large public testing sites for the city of Nashville or Davidson County. That has been under the control of Meharry since the beginning of the global pandemic. And we've seen well over 200,000 patients that have come through our testing and assessment sites. And what I can tell you firsthand is that a gift like this is more than just a tool used to test our students who come back to our campuses. It's more than just a tool, as Dr. Frederick mentioned, where we're the hub and the spoke of the schools that we serve in the Tennessee area that are the spokes for us to be a hub. Having a CLIA certified lab is extremely important to all of our institutions. That is not an easy thing to do. Very few of us have them. And to have a CLIA certified lab with the support for the next 3 years obviously bolsters the research enterprise. But when you're looking at what we're facing with a global pandemic right now, many people don't realize that lab throughput is one of the reasons why there's a lot of bottlenecks in various cities across the nation. The labs that are currently operating that still have to deal with pathology coming from hospitals and other disease states have been inundated with quick, rapid testing needs for the greater population to identify whether or not you're infected with coronavirus. And in doing so, we've seen at the peak times of this disease that lab results or test results coming back have taken as many as 2 weeks, especially at the peak of our testing across the nation. We're going into cold and flu season right now. There's going to be bottlenecks again. And this gift to these institutions help relieve that. It also helps relieve what I would call an unfunded mandate. When this global pandemic hit in, late February, early March, schools were letting out, and because of the pandemic, a lot of schools shut down, and we kind of ended and thought that when the fall would resume and school would resume in the fall, that we would have this beat or that the curve would be flattened, et cetera, unless you're an infectious disease expert and you kind of knew that that wasn't going to happen, but the general population thought so. And so colleges were not prepared to be able to test test quickly students coming back and making sure that they weren't going to be infecting the greater community that they were returning to. This gift allows for the 6 colleges mentioned to be able to be a hub and provide resources for those spokes to address an unfounded mandate. Many of our colleges just don't have the budget. It's very expensive to test and to test frequently. You can't, as you all know, you don't test one time and then you're good for a year. This is an airborne virus that is spread pretty easily. So frequent testing and rapid testing is important. But if you're on an already stretched budget as a small institution, to be able to do that regularly will kill your budget. So this gift and the subsequent support that has followed with other funders wanting to match this and help this support happen is extremely important to this fight against this global disease. But it's even more important to the communities that historically have been left behind when something like this happens. So I want to say thank you on behalf of Meharry Medical College to the Bill and Melinda Gates Foundation for this support. It goes beyond just a gift. It goes beyond just the CLIA certified lab that can help bolster our research enterprise. It sends a signal to
Patrick, your audio is cutting out. It could be my internet. Is
I'm
everyone
sorry.
still there? Oh, Patrick, you cut out for a second. You want to get back to
Okay.
what you were saying?
Yeah, I'm not sure where I cut out, but I'd like to say that this gift from an institution like the Bill and Melinda Gates Foundation is significant, and it sends a signal to all philanthropists across the nation that if a known philanthropy such as yours is willing to make this level of investment, that these institutions and the communities that they serve are equally important to their consideration as well. So I appreciate you being a trailblazer in doing so. Thank you.
Thank you, Mr. Johnson. Let's move to Dr. Sandra Harris Hooker with Morehouse School of Medicine.
Good morning, and thanks to all who played a role in bringing these discussions to reality. And on behalf of the Morehouse School of Medicine, we earnestly thank you for providing us the capacity to make a difference, not only to the physical, but to the mental well-being of students at historically Black colleges and universities, as well as the communities we serve. Morehouse School of Medicine has actually been testing our faculty, staff, and students since around April, and we now have moved to testing faculty, staff, and students on a 7 to 10 day rotation with our periodic testing. However, the Gates Foundation Award is actually multidimensional in its reach and impact. First, it allows us, of course, to safely return our students to campus and provide them with a sense of ease and well-being through routine COVID testing, impacting, once again, both their physical and mental, which is extremely important, well-being. Next, it provides the opportunity for us to hire very skilled laboratory technicians. While we need those in the lab, this also strengthens the workforce during this very challenging economic time. And lastly, as a hub institution, Morehouse School of Medicine now has the capacity to extend our reach beyond the communities that we serve traditionally into our neighboring cities and states. This creates a ripple effect, allowing us to greater impact and the ability to foster relationships to improve the health and well-being of so many families and communities. This aligns so well with our mission and the trust that we have built over the years with our communities. They trust that we will do this and we will do it in the right manner. Once again, we thank the Gates Foundation for recognizing the invaluable role that historically Black colleges and universities play in serving minority and underserved populations, and most importantly, for assisting us in empowering our students, not only to return to campus, but to do so having the knowledge that they are able now to keep their friends and family safe from this deadly disease. Thank you.
Thank you. All right, well, live press conferences. We have had a switch for Hampton University. So I'm going to go next to Hampton. And would you just state for the record your name and title to help the reporters on the call? Thank you.
Yeah, absolutely. Good morning, everyone. My name is Michelle Pinmarshall. I'm the Vice President for Research, the Associate Provost and the Dean of the Graduate College at Hampton University. It is my honor and privilege to be able to speak on behalf of Dr. William R. Harvey, President of Hampton for the past 43 years. His visionary leadership has placed Hampton in the position to do a lot of things that we have been able to successfully accomplish. I cannot thank the Bill and Melinda Gates Foundation enough for their generosity, their compassion. They have helped to open the doors for our institutions and others to receive funding from other agencies, to be recognized as a very important leader in higher education. We are pleased that we will also have a CLIA certified lab. It's going to place us in the position to be able to provide vaccinations once an approved vaccine is available. We were able to purchase a mobile health unit that we can go out into the community and provide testing, provide education, provide other resources for a community of people who have been, what is the word that I'm trying to think of? They have really been marginalized. So to be able to extend that reach and that arm because of the funding, to be able to train our students in the School of Pharmacy, in the schools of nursing, our health disparities students, and to show them so that they can lead the way with the compassion that they have seen others extend to them. I am so very thankful. I know everyone on this call has said and expressed their gratitude, but we cannot express our gratitude enough to the Bill and Melinda Gates Foundation, for Thermo Fisher for leading the charge and donating the equipment initially, sending people to train us so that we could know how to use the equipment and know how to test properly so that we can eradicate this global pandemic. Hampton University is in its 153 years, and I look forward to generations to come to be able to take up this mantle and do what others have done for them. So thank you, Bill and Melinda Gates. Thank you, Thermo Fisher.
Okay. Now we're going to go ahead and move to the question and answer portion. And if you are a journalist and you missed the very beginning of the call, we're putting the questions all inside the Q&A over here. And a few have come in since we've been speaking. I'm going to go ahead and take them. I'll try to do my best to take them in order. But I see that Inside Higher Ed, Rick Seltzer has two questions. Rick, if we could unmute you, if you could ask your first question, actually, since that is specifically for Dr. Frederick. Let's start with the question for Dr. Frederick and then open it to your larger, broader question that you had.
That sounds good. Thank you so much. Dr. Frederick, I sent this in when you were discussing the hub and spoke model. Could you talk a little more, please, about the logistics and what that involves? Do other HBCUs send you their tests to be processed? Are there specific ones you can name? Is that the way it works, or am I missing something there?
Yeah, that's correct. The other HBCUs have also received testing kits. They're able to collect the test and they'll send it to our facility to be tested. They have access to all the data. They will own and have responsibility for all the data. Our guarantee is a turnaround time once we receive the test of about 3 hours based on the lab that has been set up. And so that's the hub and spoke that I described. Bill and Melinda Gates Foundation is supporting standing up 10 of these that will serve other HBCUs in a regionalized setup. We're currently doing tests for Norfolk State and in discussions with a few other HBCUs to begin doing their testing. But our lab was stood up about on September 9th, and we've been doing testing since then. We've been doing testing for Norfolk State since then.
And then Rick, you can go ahead with your second question that you had. Yeah.
Thank you so much. This is for all the leaders that are on this call. Have you run into, or did you experience either over the summer when doing procurement, or more recently, did you run into testing bottlenecks if you were trying to, maybe when you were returning to campus and needed a ton of tests, with commercial providers, or, and by bottlenecks, I mean either procuring the tests or also just getting results in time. Can you explain if you had any experiences like that? Could you talk a little bit about what those were like?
Yeah, this is Patrick Johnson with Meharry Medical College. We had experience with that, not only at Meharry, but with sister institutions around the city of Nashville. And a lot of that was obviously predicated on spikes happening around the country because of Memorial Day, 4th of July, end of summer, where people were being pretty much, as you would say, I don't want to use the word reckless, but a little more carefree to opening up for the summer. And that caused a spike in testing because obviously infection rates went up. And so people were fearful and started running to any place that they could get tested, which then we also had, and I think Dr. Frederick or anyone else who was running a public site, there was a shortage on supplies across all labs across the country with finding reagent and things like that. So it did cause a bottleneck, and we saw that. And there weren't a lot of additional labs to seek throughput to address that need coming into the fall. So that was a reality.
Okay, we have a question. We have a question here from the 74 that I'd like to take. It's Taylor. And so let's unmute Taylor. And Taylor, could you ask Ashley the question that you have here about the 15 million over 3 years? I'd like for Tony Hoover to answer that from the Gates Foundation, if possible.
Sure. Hi, guys. It's Taylor with the 74. I was just hoping to help make the funding amount just a bit more tangible for our readers. When we say 15 million over 3 years, what does that translate to? How many tests made possible? I don't know the right time frame to use per week, month, year, made possible at each of these schools because of this funding that wouldn't be possible otherwise.
Thanks for your question, Taylor. When we reached out to the university presidents, we asked them what unmet needs did they have. And they told us that they wanted to have sufficient testing capabilities to test their students, their faculty, staff, and community members. So I would have to defer to the presidents around the actual numbers, but our gift to our grant to each of these universities was designed to enable them to test all of their students, faculty, and staff as often as their own protocols require.
Yes, this is Sandra. Morehouse Medicine. I can add to Tony's comments.
Great, Sandra. Yeah, go ahead. That's great.
Absolutely correct. Thermo Fisher came in with this JUST initiative. However, their gift has to do with the test kits themselves and some of the major equipment. However, that did not give us the full capacity. And the Gates Foundation stepping in gives us full capacity to staff our labs, purchase all of the consumables that go along with having the equipment, and really move forward to test as many kits as we receive. And we will receive kits to test all of our spoke institutions. Each of our hub institutions are designated. For instance, Morehouse School of Medicine will test the HBCUs in the state of Georgia, North Carolina, and South Carolina. Those kits will be sent directly to the spoke institutions. They will do the sampling of their students, staff, and faculty, and then they will ship those samples off to our hub institutions, where the facility that was stood up by the Gates Foundation will carry out the tests and then return the results to the spoke institutions. So we will have the capacity to test as many students, staff, and faculty that's tested at the samples are collected at the spoke institutions.
And was there one more university president that wanted to speak to that? I thought I heard someone else try to jump in to answer that one.
Yeah, nothing to add. That was me, but nothing to add.
Okay, okay, very good. Taylor, you had another follow-up question that I'll let you go ahead and ask.
Yes, sorry, I said to speak going on. I just wanted to confirm on 2 points, just to clarify that the sites were chosen because of their public health link lab capacities, or if there were some additional reasons that were taken into consideration. I don't know if like the surrounding community played a role at all in the selected sites, and also if at most of these schools there's already been some capacity for rapid testing that's now being bolstered, or are there any colleges where this is going to be an entirely new effort because of the Gates Foundation funding?
Tony, do you want to try answering that for us?
Yes, Taylor, we became aware of the JUST project and the uniqueness of this hub and spoke approach that was unique in that these universities were going to be collaborating to enable the testing to take place across the HBCUs. And we were very much intrigued by this new model, this network model, and we saw great potential in this model. And that's how we selected these 6 universities who have already received grants. And we're continuing to have discussions about a maximum of 4 additional universities that would serve the purpose of being testing hubs.
Yes.
I'll have to defer to the presidents for the second part of your question.
Yeah, if I could, this is Larry Robinson at Florida A&M. Thanks, Tony, for those comments. But the answer to your question for us is yes and no. As I indicated, we've had a state-sponsored committed testing site on our campus since April the 25th. That site, we're very proud of that, is available to all the citizens in Tallahassee, Leon County, and this region, 56,000 persons since we started it. But what this gives us, is the unique capacity to have our own CLIA certified testing laboratory on our campus. We did not have that before. And as much as we appreciate the significant investment in equipment and test kits being provided by Thermo Fisher, what this does is allow us to hire those critical staff members needed to make this operate. And now we can focus specifically on the internal needs of our students, faculty, and staff as we move into the fall and spring semesters of 2021.
Dr. Verrett, I felt like you were trying to add something there.
Nothing more. I would underline what Dr. Taylor just said.
Okay.
Josie, can I add a little color to
Yes, go ahead, please.
This is Patrick Johnson with Meharry. Just to give a little color to what Dr. Robinson mentioned, for those of you who don't know, Vanderbilt University, which is a few miles from Meharry Medical College, has its own CLIA certified lab. And since this pandemic, kind of hit us late February, early March, and we've all been in the throes of it since then, the benefit of having this kind of lab on site for you, Vanderbilt has not missed a beat with testing its students, faculty, and employees on their campus at will, how they needed to keep their operations running and safe and not be dependent on external labs to do so that get overrun, whether you're LabCorp, Quest, Path Group, or anyone else. So for Meharry and the rest of these schools here on this call, for us to be able to do so ourselves is extremely important to the health and safety of our institutions. And we're all in healthcare in some shape or form. But more importantly, it helps relieve the stress on the public health need that those labs like LabCorp, Quest, and Path Group have to serve for a large public population. So to put that in context, to be able to do this in-house yourself is the equivalent of having a kitchen in your house and not having to eat out every single day. It's just far more efficient and effective.
Taylor, was that all of your questions?
I think I wanted to circle back. I believe it was Sandra. There was a comment that the grant allowed us to open, and admittedly, I haven't been able to check all the university websites, necessarily have the full background context. But are all of your universities open right now or partially open? And is this funding enabling some of you to open more?
We are probably all at different stages, so I'll allow our colleagues to answer for each. We at Morehouse School of Medicine, we are open. Our sort of hashtag is you really can't train a physician virtually, not in full capacity anyway. I mean, a gross anatomy lab has to be done on campus and face to face. So this does allow us to keep moving and keep our doors open, but let us not miss that it's not just about our individual institutions. What this gift does is allow us to also reach out to the other 108 or so historically Black colleges and universities allowing them that same capacity to open their doors to their students. So while we're here representing the hub institutions, this really is more about us reaching out and not just what we are doing for our individual students, faculty, and staff.
What may I, if I might add, this is around from Xavier, that I would add that the in-person education experience has been important to many of our sister institutions, not just Xavier. We are open. And to many of our sister institutions, they are open in person because we have known that the in-person experience is an important part of the education that we offer. And the benefits of it have been clearly and demonstrated historically. The important thing has to be how we did it with a measure of safety. And that's been the concern of not only myself, but all the other leaders of my sister institutions. And we're managing through it. We're doing it. And this testing makes a difference.
I don't see other questions from the press, so I'm just going to put it out there that we still have some time. Oh, Taylor has a clarification. Go ahead, Taylor.
Yeah, hi, sorry. I just I'm in the DC area, so I wanted to get a little bit of a more robust sense of what's happening for Howard University. I want to just go back really quickly. Mr. Frederick, I believe you were answering another reporter's question about like a turnaround time of 3 hours. You mentioned that testing starting September 9th. I just wanted to circle back and clarify, is this testing linked to the grant funding that started September 9th? And are there any metrics you can provide on how frequently the university is testing, how many people are being tested a week, and yeah, just any more details on how it's going for you guys?
Yeah, so a couple of things to clarify. We stood up 2 testing sites in the community, and we were testing through our hospital. But as mentioned before, kind of related to the question that was asked earlier, the delays that the country was experiencing was something that impacted us as well. As a result of the grant funding through the JUST project, we do have our lab stood up already, and it's CLIA certified already. And we've been testing since September 9th. So I'm saying specifically related to this project and your question that went before, we are actually testing now using our CLIA lab that it was set up as a result of the JUST project. Around time to run tests and get results is about 3 hours. I'm coming to work every day. Since you're in the DC area, you may be familiar with the fact that I'm a surgical oncologist, so I'm operating still. That requires that I get tested at least once a week in my capacity, and so it varies depending on how often somebody's coming to campus. Our entire health sciences complex is open, so our students and faculty, our research enterprise is also open. And we do have a few students housed in an apartment that are related to students who have housing and food insecurity. And so they are also being tested on a regimen. So the testing frequency varies depending on the activity that students are participating in. On our website as well, we have published our test results on a dashboard that's easily accessible. I would give you the results, but by the time I give them to you, they probably would be old. At that point, but you're more than welcome to check our website, and you'll see the testing results and the details of what we have stood up regarding testing. About less than, I would say around 0.63% of our students, faculty and staff have tested positive to this point. So we do appreciate as well the cooperation, the immense cooperation we've been getting from our community as well in terms of the other factors that are important, such as social distancing, wearing masks, etc.
All right. Lauren Lumpkin with the Washington Post. Do you have a question?
I do. Can you hear me? Yeah.
Yep,
Okay.
I can hear you.
Thanks. So I have a couple questions for Dr. Frederick. So first, I know that your campus is mostly online. Can you talk a little bit about how this will affect your ability to bring students back to the campus?
Yeah, as we evaluate the spring, our task force is looking at bringing students back. This would be a major factor in our ability to do that. The ability to test and have turnaround this quickly will enhance our ability to do contact tracing, isolation, and quarantine appropriately as well. So this is a major difference from when we were looking at opening in the fall, and we were thinking we would have to, even if we could collect the specimens at Howard, we still will had to rely on reagents coming in. We had to rely on sending the test out in some circumstances, etc. This would give us a different level of capacity and certainly enhance our ability to do that. This would just be one factor, though. This certainly will not be the only factor that we'll take into consideration. I want to still underscore that we employ more African American faculty than any other higher ed institution in the country. And so with African Americans being at risk for not just contracting the virus, but also dying from the virus, we have a different level of obligation to make sure that we keep everyone safe. And until we are convinced that we can do that, that'll be a factor. We are going to participate in a phase 3 vaccine trial as well. And so we'll see how those progress before our start date in the spring as well.
Okay. And then I'm also wondering how many HBCUs do you think you'll be able to serve within the first year of this grant?
Yeah, it's a great question. You know, for Howard, we are looking at Coppin State, UDC, Morgan State. There are probably 5 HBCUs in our area. I think this was a very well thought out project. And so when you look across the landscape of the country, the intent was really to have all the HBCUs participate. And if you have 10 hubs, I'm sure the other schools, I will mention to you that they're probably going to serve anywhere from 5 to 10 different HBCUs. And so with us being a total family of about 104 HBCUs, I think we do have the capacity to cover just about everyone.
Yeah, it's locked in at Florida A&M University. Will be the hub for Bethune-Cookman, Florida Memorial, and Edward Waters College. And when you think about where those are, Daytona Beach, Jacksonville, Miami, you know, the community impacts are tremendous when you think about where persons of color reside. And as I said earlier, each of those institutions are located in those very special places. So the health and safety of the students translates into the health and safety of the community as well. So it's going to be a tremendous impact of this investment on the health of our communities throughout the HBCU world over the next several years.
Great, thank you. I see we have 2 remaining local questions that I'd really love to get to before our hour is up. The next one is from Chelsea Donovan, who's with WTKR. Chelsea, if you want to go ahead and ask your question. If we can't get Chelsea unmuted in the next few seconds, I'll read it out loud. And I would ask Dr. Michelle Pinmarshall to go ahead and address it. She asks, how does this further the education? Is that you, Chelsea?
Yeah. Yeah, okay. Can you hear us?
Yep, okay, go ahead.
Yeah, we just wanted to see how this program furthers the education for students at Hampton U. How can they get involved, as well as who are they testing, as well as being a hub site?
Okay, so Hampton University is testing the HBCUs in the state of Virginia, as well as 2 HBCUs in the state of West Virginia. And I have a call Friday morning with an HBCU in Texas. So we're possibly going to be testing 8 spoke schools as a hub. Our students are going to be involved via contact tracing. They will help us in the computer science department with setting up dashboards, much like Howard, Dr. Frederick explained that they have. Our students will also, our clinical students, our pharmacy students will be very helpful with immunizations, because as we think about flu and the flu season beginning and compounding that with the pandemic, with the coronavirus, we are going to be providing immunizations as our pharmacy students always have. So that type of instruction. We're also adding on our communicative sciences and disorder students for speech and pathology. A lot of times people that are hearing impaired are left out of these conversations and these opportunities. So being able to bring our clinical students back on campus, especially in that particular department, is going to be most helpful to us. And I believe you had a third part of the question that I do not recall and I don't think I answered. Would you please repeat it?
Yes, just how does this help further the education for Hampton University students?
At Hampton, we believe in letting our lives do the singing. So our student body is very much interested in helping the community, and whether they're helping the community by voter registration, whether it's with the pandemic and getting information out to their own peers. The president met with our student leaders last week and really asked them some hard questions about what they thought about the pandemic, how it has affected their ability to learn, because during the fall semester, we are remote for the most part. So our students are working with faculty members synchronously, asynchronous instruction, and the students want to be safe. They want to be advocates for others. They want to make sure their family members are safe. They want to make sure that they are safe and each other, so they hold each other accountable. And that's really a serious, they really are maturing and showing their level of maturity by those types of decisions that they're making and the conversations that they're having. So the education that they're getting, because they're able to pivot, because they're able to demonstrate resilience, because they're able to support each other during this time. I did not experience this in my lifetime during their age, where my parents did, but I did not. So to see the type of education that they're getting from their instructors, the compassion that they're showing for each other and the community, and then how they're applying that, whether they're Scripps Howard School of Journalism and Communication majors with dissemination of information, whether they're applying it in the clinical aspect, whether they're applying it with sociology and psychology, and they're really thinking about how is this affecting people's mental health and counseling as well, and in education and dissemination of information. So I hope that that answers your question.
Oh, thank you. We have one last quick remaining question, and it will go to Dr. Larry Robinson. Micah wrote in, and Micah, I don't actually know the organization that you're with. If you could explain or clarify that for us, it'd be great. But it is a question in regard to turnaround time. And Micah, are you on to be unmuted?
Yes.
Okay.
Hi, Dr. Robinson. I'm Micah Cho with ABC 27 here in Tallahassee. Just a quick question. So the other day we talked to some staff, and they said that I think turnaround time is going to be at 24 to 36 hours. Is that changing now, do you think?
Well, that might not change a whole lot, but the capacity in terms of the number of tests we can get done in that time frame will obviously change, and that would make a huge difference. And so it removes the burden, off of the existing site that you're fully aware of. And by the way, this is the only and the first community-based site in this region of Florida where there was no requirements for physician referral, didn't have to be symptomatic. You can drive up, walk up, or whatever. And we're going to keep those components of the program. However, it will, you really can't change the science, but we can really get more throughput, and that's really what we need as we bring more and more students and faculty and staff back to the campus environment. So that's going to really be the added value of this new capacity that we have.
Okay, we are at 11:29, and I know everyone on this call will probably have to move quickly to their next event. So I'm going to go ahead and wrap us up and really genuinely thank everyone. I know that your time is valuable, so thank you everyone, both media and the university representatives that we had on today. Following this, I'm going to send out a fact sheet to you all and bios of both our foundation representatives on the call and the university representatives from this call. Rick, I know I missed one question that you had in there. We'll follow up with you as well. And I think everyone knows where to reach us. Thank you again. Talk soon.